And what I think you're seeing is a little bit of what we call Team Kentucky, but what others could call coming together to find common ground, putting our families first and doing the right thing because it is the right thing. We are here today because something more must be done to help those suffering from diabetes so that they can afford the life-saving medication that they require. Every day, Kentuckians are losing their life and permanently damaging their health because they cannot afford their daily supply of insulin. We have not only heard, but we all know people experiencing those upsetting stories about having to use inferior insulin, about having an insurance company tell you that the insulin you need is a luxury item, about people having to ration insulin or even bypassing treatments. These practices are dangerous, and we hope that we can make them unnecessary. Last year, I wrote an op-ed about this exact subject where I mentioned that at a public legislative meeting in Frankfurt, one woman said she could not afford insulin for years. As a result, she developed other diabetes-related chronic diseases, one causing the loss of her leg below the knee. She said it was nearly impossible for a vast number of people to afford and wondered if she would make it another 5 years. A little under a year ago, I was in Moorhead at a teacher meeting. The teachers had chosen that they wanted to have a cause in addition while they were there, and so they had a young girl, bright as she could be, who needed a service dog because her condition was so bad. And I asked her a question. I said, what does your family have to pay every single month for insulin? And she answered a little different. She said they pay over $1,000 a month just to keep me alive. That sticks with you. Insulin is not something diabetics take out of convenience. They take it just to stay alive. And let me be clear, and you're seeing that here today from everybody. Diabetes is not a partisan issue. And today, you are seeing people coming together to address it and working in a bipartisan way to support a good bill that the people of Kentucky are depending on us to pass and for me to sign. While the disease is not partisan, it is a health epidemic here in Kentucky. We rank 7th in the U.S. for diabetes prevalence. 7th. According to 2020 numbers from the Cabinet for Health and Human Services, our Cabinet Secretary is here today, 1 in 7 Kentucky adults have diagnosed diabetes. 158,200 adults are estimated to have diabetes but are not diagnosed. That's on top of the 1 in 7. That is 632,700 Kentuckians with either diagnosed or undiagnosed diabetes, and 1 in 4 don't even know it. As for prediabetes, 1 in 9 Kentuckians have diagnosed prediabetes, and 812,000 adults are estimated to have prediabetes but are not diagnosed. No one should go undiagnosed because they cannot access health care or afford it. Getting care improves health outcomes and helps Kentuckians. We cannot turn our backs on helping our Kentucky brothers and sisters get healthier. That's why I'm so focused on expanding access to affordable health care for Kentuckians every single day. And it's why our budget proposal committed to fully funding expanded Medicaid and in signing up especially every single child that qualifies for K-CHIP and getting them on K-CHIP. As Kentuckians suffer, pharmaceutical companies that control 96% of the world's insulin rake in billions. While our people ration and sometimes die, they make record profits. It is simply wrong that these companies that pay between $2 and $7 to manufacture a single vial of insulin, while they set an average wholesale price of about $300 for that same vial. As Attorney General, I filed a lawsuit against 3 of the largest makers of insulin. I believe we should continue that lawsuit, and I hope the new Attorney General does. These companies ought to be held accountable for making record profits while Kentuckians lost their lives. In that lawsuit, we gave specific examples of how companies were increasing insulin over a 10-year period. For example, prices went up 311% on one product, 285% on another. And on a third, they increased $235 per package just in 2011. Price went up to $530 per package by 2017. And another product more than doubled in price from $255 per package in 2012 to $558 in 2018 without anything changing in that product whatsoever. So while these companies work to increase the bottom lines and sustain market shares, Kentucky families hit hardest by this price gouging could be paying more than $1,000 a month just to stay alive. The ruthlessness of these companies is clear when you consider in 1922, the creators, the inventors of insulin, sold their patent to that product for just $1. They wanted this to be their gift to the world, that no one would have to suffer and that everyone could afford life-saving medication. But look at where we are. Passing this bill will help hold down the out-of-pocket cost of insulin. And we know it can be done. Colorado has already signed a bill that caps co-payments of life-saving medication to $100 a month for insured patients. Illinois became the second U.S. state to cap the price of life-saving insulin after their governor signed a bill into law just last month. And other states are considering it just as we are. These other states know what we know. When insulin is more affordable, more folks get the care they need to live a better life and to better manage this disease. Let's let Kentucky be one of the first on this issue. And let's acknowledge that our legislature is leading on this issue. Those who depend on it, those who need insulin at a lower cost, deserve nothing less than our full efforts. Let's fight for Kentuckians in need. Let's fight for our brothers and sisters and our neighbors, knowing that this impacts hundreds upon hundreds of thousands of Kentuckians. We must do better, and this piece of legislation is definitely a step forward into doing better. I'm now going to introduce one of the sponsors for this bill, Representative Danny Bentley.
Thank you, Danny.
Thank you.
Does everyone know what this is? This is the Atlantis Solar Star pen. They come in boxes of 5, and according to GoodRx this morning, which I went to the computer, this is $357. So if you use 4 boxes, it's pretty simple math. It's about $1,400 a month or $1,500 a month. So that's what people who pay cash are up against if they're on limited incomes. First, I would like to thank all the members of the representatives of the House and also Sarah Ferguson from Insulin for All for being here today and knowing the severity of it. I appreciate all of it. But you can go to GoodRx if you really want to see it. In my list, I got this morning hot off the desk, and I was talking to Representative Minter, and her son uses Humalog. Even the 5-pack on that's $175, and that's a rapid-acting insulin. So if you want to know about insulins, I'm the man to ask, because I know how long they last and what brands they are. But what I really want to talk about is that a couple of years ago, we started a diabetes task force, and I was chairman from the House side on that. So last year we passed Kevin's Law, which gave pharmacists the ability to give you a 30-day supply if you went into a pharmacy with a no refill, also an albuterol. I'm sure it saved some lives in Kentucky that they could get that extra vial or extra pen until they could get a hold of the doctors. The sad thing is there was a lady named Kayla Davis from Owensboro, and on June the 5th of 2019, a 29-year-old died of ketoacidosis. Her sugar was 850. Now, I have friends that are representatives in this group that had ketoacidosis before. What happens, you go into flu-like symptoms, and finally you go into a coma and death. It's not a pleasant death. What happens is the pancreas produces your insulin, and it can go to 3 places to work: muscle, adipose tissue, or the liver. And so when you don't have insulin, sugar goes high, your body says, we need energy, So it goes to burning of fat, which gives you ketones, which is ketoacidosis. And that's where you die from, what you die from it. So in the House, we okayed a resolution for ketoacidosis day in April. We have a bill on the cost of insulin. We have a couple in line. This one number I never can remember, but it's 423 for cost and co-sponsored with Representative Sheldon. So we're working on the cost, we're working on awareness, and we're working on trying to make people's lives better. In eastern Kentucky, where I'm from, diabetes is double digits, and I've worked all my life. I'm a community pharmacist to educate people about that. So thank you for coming, and thank you, Governor, for the attention today. Oops, I've got your notes.
That's okay. You can take those too. Next, we're going to hear from Representative Patty Menter.
Thank you, Governor, and thank you so much to my colleague and friend, Representative Danny Bentley. It has been a joy to work with him on this bill that is going to save lives. And without insulin, one of the lives that would not be here is my son, Alex. In 2006, our lives changed forever when his child care center called me at 10 o'clock in the morning when I was at work and said there was something wrong. And by 12 o'clock that day, we had a diagnosis, not only that he lived with type 1 diabetes, but he was in diabetic ketoacidosis. I asked what I should take to the hospital, and they said, nothing, you need to go right now. And they were debating whether or not to put him in an ambulance. I didn't know at the time everything that Representative Bentley has shared with you. I probably wouldn't have been able to work the car had I known any of that. I just knew that my son needed to get to the hospital, and for 3 days he was in the pediatric ICU as his sugar was brought under control, and his father and I learned how to give half-unit injections of Lantus insulin to a 19-month-old boy. So we have lived with this as long as he has, and until he was old enough to manage his own disease, we managed it for him. And I watched as month after month, year after year, the cost of his life-saving insulin went up and up and up. And I became a resource for other people in my community. When someone's child was diagnosed, they'd say, you need to talk to her. And one of the things I heard over and over again was the expense. How can I pay for this? Why is this so expensive? And I watched in my own bills as the curve went up and up and up. So when I heard that there was a bill in Colorado to cap the cost of insulin at $100 for a 30-day supply, I thought this is the beginning of the solutions that we need for Alex, for my colleagues Representative Bentley and Representative Booker who live with type 1 diabetes, for all of the Kentuckians that none of us will ever see or know, but who are counting on us to make sure that no one in Kentucky will be deprived of the life-saving insulin that they need. I truly believe that access to insulin is a human right, and no Kentuckian should be without the life-saving drug that they need not only to live, but to have a good quality of life. No one should have to go on dialysis or lose a limb because we did not act. I'm so proud to stand with 71 people in this body as a model. 71 people. Thank you all. This is a model of how we can do this and show what is best about the government that serves the people of Kentucky. I'm proud to stand with Governor Beshear, with 71 of my colleagues, as we are on the precipice of being able to pass this bill that will be a great start to make sure that everyone has access to the life-saving drug that they need. On behalf of Alex and every other person who lives with diabetes and needs that life-saving insulin, I urge everyone to support this bill, urge your Senate colleagues to support this bill. Let's get this done for Kentucky and for Alex. Thank you very much.
And Alex is now
14.
14, and he's about 6'2", right?
Yeah.
Yeah.
And he needs 3 vials of insulin a day.
Yeah.
Or not a day, a month, sorry. A month.
And next we have Sarah Ferguson from Insulin for All.
Hi. I just want to say that my daughter is 23. Her name's Samantha, and she lives with type 1 diabetes. Governor Beshear mentioned somebody who testified last year in front of the Senate Banking and Insurance Committee. That was my friend Angie Summers. She lost her leg from years of rationing insulin and not being able to afford her prescription. She was here at the beginning of this session ready to talk to people, but she's in the hospital now because she's losing her remaining leg. And that's from years of being unable to afford her insulin. Kentucky Insulin for All thanks Representative Bentley and Governor Beshear for listening to Kentuckians and taking action on insulin prices. As Attorney General, Governor Beshear filed suit against the 3 insulin manufacturers for deceptive pricing schemes, and we're closely following that case as it continues. Representative Bentley, as co-chair of the Diabetes Emergency Task Force, listened to us and sponsored Kevin's Law, so now people with diabetes can pick up a vial of insulin if they need it in an emergency and their prescription has expired. House Bill 12 is a small step forward for Kentuckians struggling with high insulin prices, putting a $100 copay cap on insulin for people with state-regulated health insurance. For everyone who uses insulin, outrageously high prices are forcing people to make choices. But insulin is not an option. You must have it to live. The choice becomes what to skimp on, whether to pay the rent or the electric bill, or even how little insulin you could possibly get by on. Rationing a liquid that costs $6 to produce but costs $300 a vial. People are dying. People in Kentucky are dying because they can't afford insulin. Children are being removed from their homes and put in foster care because their families can't afford to take care of them. GoFundMe is full of people begging for money for insulin, and social media is now a place where we connect and send out alerts about people who are in desperate need. We don't have time to work around the edges of this crisis. There are other bills in the legislature this session that could help many more people who are struggling to pay for insulin. People on Medicare, people with federally regulated insurance plans, and the uninsured. Representative Bentley has filed some of these other bills that would help more people in the Commonwealth. He's filed House Bill 249 calling for insulin price transparency. We also have to remember the uninsured because they are the people who pay that full list price of $300 a vial. There's Senate Bill 23 that would guarantee a safety net for these people by establishing a fund to help people who can't afford to pick up their prescriptions. Kentucky Insulin for All supports these bills, and we're grateful to have a governor, along with senators and representatives, who are working to take action at the state level to help Kentuckians with diabetes.
Given that we have so many lawmakers up here, and given that they're currently considering my budget, if anybody has an additional short statement they'd like to make, we'd be happy. Please.
Tomorrow is National Diabetes Month, and this HB 12 could be heard tomorrow, couldn't it? So wouldn't it be appropriate if we talked to our leadership and have it heard tomorrow? So, yeah.
Yes. At this point, we'll take questions on this topic, and then we'll let everybody head out. And if there are any additional questions, I'm happy to take them on other subjects.
Yeah, would this cause insurance rates to increase?
I do not believe it should cause insurance rates to increase whatsoever. I believe that the amount of profit that is currently made off pharmaceuticals is disgusting, that it puts corporations ahead of our people, and this is one practical step that we can take that shouldn't cost us any more. That doesn't mean that there aren't folks out there that might try. But in our Department of Insurance, and I believe across the hall, we'll be ready.
No, we did a study on 0.7 to 24 cents.
And what is,
How much?
will this apply, like, if there's a family, there's several family members with diabetes, will this cap be for each individual or just for the family?
It's each individual. That's it.
Okay.
Can you explain any kind of relationship between this bill and bills like House Bill 423 and others that were mentioned earlier?
You mean on price, the price of insulin?
Yes, just how you plan to roll out these bills and the relationship between them, if there's any overlap or gaps in one.
Well, on that one, I'm gonna
Yeah,
throw it
please.
up here. Steve, you here?
Sure.
Steve and I co-sponsored this, and what we're trying to do is the new way of pricing drugs. You want to explain to them, Steve?
What we're trying to do is, we realized that there was a gap in House Bill 12 that left the cash-paying customer and the people that are uninsured out. So we attempted to emulate a federal law that that has not been passed, but tried a couple of years ago. And we're trying to change the way manufacturers look at pricing insulin. And if we do that, we're able to get that price, the sticker price down, and the price that comes to the wholesaler is lower. Therefore, the price that goes to the pharmacy is lower. Therefore, the consumer gets the price break right off. So we're calling it certifying insulin, and it gets into a lot of detail, but that's about as simple as I can make it.
Yeah, that's House Bill 423.
And do you know when we can expect debate on 423?
Well, you can help us with that.
Well, leadership is not here, but you can sure put in a good word
That's
for us.
right.
Yeah.
Everybody needs to call.
Right.
Everybody needs to
And
call.
all I'd add, and it's a problem with all pharmaceutical pricing, is the phrase you just used, sticker price. I mean, we have life-saving medication being treated like you're buying a car, where no one knows the actual price of it. It is hidden. It goes through multiple different entities, from the manufacturer to the wholesaler, sometimes to another one, before it's ultimately provided to the consumer. And I don't think that life-saving medication ought to be treated like a car with a sticker price. I think all of us, and I think this country wants transparent pharmaceutical pricing. I think we understand that there could be volume discounts potentially from it, but it's the fact that there is zero transparency in something that's absolutely critical for all of our people.
And that brings up a point. House Bill 398, 399, and 400 deal with PBMs. And that's where you don't see a lot of transparencies with PBMs. And Steve and I are co-sponsors on those three bills also. So we're trying to help the Commonwealth, the people that are suffering and dying because they can't afford their medication. And then, you got one more? Might as well hit them all.
Go ahead.
Keep with the
House,
list.
Bill, House Bill 72 is an RX accumulator bill where people go in to get their prescription. They would have a discount and it would be added to their deductible. So if you want to review that, and that helps people buying their medication too.
Anybody else? Thank you all very much.
Thank you,
Thank
Governor.
you.
You receive mine?